Indigenous peoples in Canada face major barriers in accessing healthcare, especially when it comes to mental health. And Dr. Christopher Mushquash has dedicated his career to changing this. The Anishinabek clinical psychologist and researcher provides assessment, intervention, and consultation services to children, adolescents, and adults in his community of northwestern Ontario. He also conducts research on mental health and addiction, using evidence-based practices that align with First Nations values. This often means getting out of the lab to hear from as many people as possible. From measuring community outcomes to integrating culture-based interventions, Mushquash believes in sharing knowledge among Indigenous and academic communities, clinicians, and policymakers. Dr. Mushquash's emphasis on the unique contexts and issues experienced by Indigenous communities has had a profound impact, influencing policy around mental health and addiction, and improving the systems and services that make a difference in people's lives.